Graves' disease is a disease that affects 13 million Americans, only half of which even realize that they have the disease. It accounts for 1/4% of the U.S. population. According to WebMD, it was first introduced by Sir Robert Graves in the early 19th century. It causes serious health issues and has many symptoms. Graves' disease is a hyperthyroid disease with a defect in the immune system, which produces antibodies that stimulate and attack the thyroid gland, which cause it to enlarge and overproduce the thyroid hormone. In this picture, the white area is what a normal thyroid gland would look like. The orange area shows what a Graves' disease thyroid might look like. Graves' disease affects women more than it does men, at a ratio of 8:1. It is usually during middle age when people get Graves' disease, but it can also affect the elderly and children also. This is a picture of my daughter, Bailey, who is affected by Graves' disease. This is before she ever had any symptoms of the disease. She was diagnosed at age 10. Graves' disease can cause serious health issues, but with treatment and education, it can be well maintained. It is not curable. The cause of it is unknown, but there are things that contribute to developing Graves' disease, such as a general disposition to having autoimmune disorders. Also, it can be brought on by stress and infection. There are many symptoms to Graves' disease, such as excessive sweating, irregular or fast heartbeat, fatigue, irritability, nervousness, eye problems, protruding eyes, distraction, enlarged thyroid gland, having a voracious appetite and not being able to gain weight, having irregular bowels, weakness, and also depression. My daughter showed all of these signs. Without knowing what you're looking for, it's hard to diagnose because it seems to look like a whole lot of other things. After you finally realize that there is a problem, the next thing is to get the diagnosis. You need to go to the doctor to have blood tests drawn, go over your medical history, and have a physical exam. The doctor will test for thyroid hormones such as TSH, T4, and T3. There is also a test called radioactive iodine uptake that can be done. After the doctor has diagnosed with Graves' disease, he will guide you through the treatment plans and different ways to take care of the problem. But ultimately, your decision is the one that you use. The first type of treatment is anti-drug therapy. This is the easiest way, is just by taking pills to take care of the thyroid hormones to level them out. The problem with this is it's only 20 to 30% effective. The second way is taking radioactive iodine. This is a process where you take one radioactive pill. Obviously, there's side effects to this also. It will kill the thyroid, but there's also a chance of getting cancer later also, so that's something you have to watch. The last way is a sub or total thyroidectomy. This is where they take part or all of the thyroid gland out. Radioactive iodine and the thyroidectomy are both 90 to 90% effective. They will also have to take a pill through the rest of their life to maintain their thyroid levels. This is a picture of my daughter as the signs and symptoms were showing up. As you can kind of see, there are big bags under her eyes, and her eyes are starting to protrude. This is another picture of her as she was getting worse. It's kind of hard to see, but her eyes are really protruding and she has a goiter in her throat where the thyroid gland is enlarged. After you have had treatment for Graves' disease, the last thing that you need to make sure that you do is follow-up care. You need to see your doctor on a regular basis and keep track of signs and symptoms that may be becoming worse or new symptoms that may show up. As you age, you may need to change your level of thyroid hormone that you are actually taking. The doctor will monitor this for you and inform you when changes need to be made. My daughter was diagnosed when she was 10, and she did radioactive iodine when she was 10, and she is now 13. 3 years later, this is how she looks. Her eyes are not as protruding as they used to be. The goiter in her throat is gone. And here are a few more pictures. And it seems as though each one she starts looking a little bit better. And the eyes are definitely better. Graves' disease is a scary disease to handle, but as long as you stay on top of it and talk to your doctor and maintain the drug medications that they are supposed to be on, it can be well maintained.